Hello, everyone. My name is Paul Kim. I'm the medical director at the wound program at the University of Texas Southwestern in Dallas, Texas. I also serve as a professor in the departments of plastic surgery and orthopedic surgery. My responsibilities include both the inpatient and outpatient care of our wound patients within our health system. Our wound care center is adjacent to the hospital, and we have 9 providers spanning 4 different specialties with 5 staff members and 8 nurses, including a physical therapist. We also have 2 hyperbaric oxygen chambers. Our practice has changed since the COVID-19 pandemic. As you all know, it's affected all aspects of medical care, and wounds are no exception. In fact, I think we've been probably more impacted than many different specialists because of the acuity of the patients that we serve. Uh, One of the aspects of how our practice has changed is in relation to seeing patients. And typically, from the wound care side, you want to see patients every week or every 2 weeks. Well, we're not able to do that anymore. What we have done is shifted to a telehealth model. And this is not ideal in the wound care space since assessing a wound involves not only a visual inspection, but also includes smelling it, touching the wound, to understand what the wound needs and how we can best treat it. There are some limitations to this technology, however. The patient perhaps has a slow internet connection, which makes video teleconferencing very difficult. Further, for our more older patients, technology is still challenging. Some patients still have flip phones, they don't have video capability, and they don't understand how to use applications within their phones or their desktops. So, all of that has to do with educating the patient on the visit experience, which we really never had to do before. Patients show up, we take care of them, and they leave for the next appointment. It's been more challenging for this patient population, not only because of their age, but their comorbidity profile, their mobility is somewhat restricted. On the same token, however, because of their mobility issues, the telemedicine platform is actually very helpful since they don't have to leave their house, they don't have to get in their car, they don't have to go to the office, they don't have to perhaps get in an elevator or even walk some stairs. They don't have to wait in the waiting room. They're still at home in their home environment. They're comfortable in that home environment. We also try to coordinate our telehealth visits with the visiting nurses that are there to do the dressing change. It's not always available. It's not always we're not always able to coordinate that, but it is an ideal situation where a experienced set of eyes are with the patient and can not only give feedback to the providers, but also give feedback back to the patient on how they're doing. However, there are times when the patient still needs to be seen in the clinic. For example, if the wound is decompensating or there is some concern at all, the patients are encouraged to come in. From the new patient perspective, one of the policies that I put into place in our wound program is that I wanted to make sure that these patients that we were seeing were patients that needed to be seen. So there would be some triaging that happens over the phone to make sure that the patient is indeed somebody that we need to see promptly. There are other procedures that we've implemented within our wound center. For example, in our waiting room, we are asking patients to sit every other chair, for example. We've actually removed some chairs from our waiting room so they're not sitting adjacent to each other. Also, if they do have masks that they bring in, then they are allowed to wear those. However, we also can dispense masks if they're not wearing masks, and it's in our county it's mandatory mask wearing in public places. So they're generally doing that anyway. There are things that have changed logistically during the COVID-19 pandemic. One of the things is staffing. So if you've got a lower volume of patients coming into your wound clinic, you don't need that number of staffing that you had prior to this event. In other health systems, nurses that are predominantly in the wound space are then reallocated to other areas of the hospital. For example, triaging patients as they come through the emergency department, or within even the outpatient wound centers, if they're part of a larger building of specialists, those staff may be asked to do temperature readings, dispense masks, and so on and so forth. And for those staff that are perhaps not involved directly with patient care, for example, scheduling or front office and anything that can be done remotely, we've done that as well to limit their exposure. One of the benefits during this period of time of using, for example, a 3M product like S.N.A.P therapy system is it's widely available. It's mechanically powered. It's logistically easier to maintain and troubleshoot, and it's been available to us for many years now. So it's not a novel therapy that we have to retrain the visiting nurses, our own staff, or the patient care providers. So it is a therapy that also requires less frequent dressing changes, as we had mentioned, which is a huge benefit during this period of time. One of the other benefits of the SNAP therapy system during this period is its mobility and its lightweight utility, which is a big deal from the patient perspective. This allows them to have some more mobility, perhaps, than other kinds of technologies. One of the other things that was important to think about during this time is the number of wound dressing changes during the course of the day or the course of the week. I think that when a patient's caregiver is doing more frequent dressing changes for the patient, I think you expose that patient to certain contaminants in the environment, and I think the risk of infection climbs. If you can simplify your dressings to those that don't require as frequent of a dressing change to be performed, I think that's a better thing for the patient. We tried to ensure that the patients would get what they need, and in order to do that, we had to simplify our wound treatment algorithm. What that essentially means is that we tried to simplify the kinds of dressings, for example, that we were using for the patient, or the types of ointments or topicals they were using, types of irrigants or wound washes that they were using. Things have changed as far as in servicing and clinical education for our staff and our providers. One of the things that has been a huge trend right now is the availability of webinars. And I've been on every one that I'm invited to just to learn about other aspects of clinical care and trying to optimize what we do in our own wound center. And these webinars are available during the day, at night. They're recorded. And one of the benefits of this is it's free education, first of all, and you continue to think about and be engaged in the wound care space, which right now a lot of people feel a little bit separated from their work. And so this allows them to re-engage. And I've encouraged our own staff and our providers and our nurses to sign up for these webinars because they're typically just free of charge. Some of the things and lessons that we've learned, I think, will be sustained. For example, telehealth. I'll give you an example on our own health system. Telehealth was one of those things that were on the horizon that we had been thinking a lot about and investing a lot about. Well, this has drastically pushed our time line forward in a very rapid and I think in a positive fashion. Also, beyond the COVID-19 era, we need to think about things like, again, as I've discussed earlier, about simplifying dressing regimens and simplifying technologies, devices, biologics, and drugs that we use on our patients to make it easier. And the duration of those dressing changes, for example, to be wider or longer times from between the frequency of the dressing changes that are made. So I think all of those things will be sustained. I want to wish everyone the best of luck. We will all survive this, and I think there are some good lessons to be learned during this very dramatic time. Thank you very much.